Hi guys, it's Patsy here,
Hi, this is Ganveer.
and today's topic is why you aren't getting a call back for your nursing job. So, why aren't we getting a call back for our like is it the fact that there are no jobs? Is it because we suck? Like we're not qualified enough? Like why aren't we getting these callbacks for jobs?
This is a very common question nowadays. It's not your qualification,
Okay.
it's how you present them.
Okay. So, okay, I want you to delve into that. How do you how do you properly present yourself as a nurse?
With your resume.
Okay.
So I think that's the main problem from my experience as a manager. Um, what I see on the resume, there are sometimes, especially for the internationally educated nurses,
Mm,
it does not even mention anywhere that they have College of Nurses of Ontario or RN or RPN license. It doesn't mention anywhere
okay.
because most of the nurses are working, or even though here in Canada, if you're in nursing school, you must be working as a personal support worker, and a lot of people do that, but then they just write their experience as a personal support worker. And as a
Mm,
manager, when I'm looking at the resume, I may not have a lot of time that I am reading every single word. I just look at the highlight stuff.
mm,
If you are not mentioning anywhere about your RPN or your RN license that you have with CNO, I may think that you're applying for a PSW job, and then I put your
interesting.
resume on the side.
Okay. Okay.
I think that is the most common problem that I see for the resumes for sure.
Mm,
Because then I
okay.
have to always look for, like, look for it, like, what exactly are you applying for?
Hmm.
And the recent resume that I saw, nowhere it was mentioned that the person was looking for a nursing job.
Okay. So so these are kind of some issues with what we present our resume and
Mhm.
but like what are some things that make a resume stand out? So like let's say you have 10 resumes. What's the thing that should be on the resume that's going to be like I want to call that person back. I definitely want to have this person on my team.
Mhm. So first of all, make sure you don't have too little information or not too much information.
Okay.
I don't want 3 4 pages resume.
Okay.
Okay, but anywhere you're mentioning your experience as a healthcare aide, PSW, or if you are internationally educated nurses, your experience from back home,
Mm.
make sure you mention that. Mostly problem that I see is people are just mentioning their time period when they were working there. There are
Mm.
no mention of their roles and responsibilities. Make sure you mention, especially for the nursing, medication administration,
Right.
nursing documentation, patient assessment, wound care.
Mm.
This is same everywhere in the
That's
world.
true.
So
Right.
make sure you mention that. And always attach a cover letter. If you know the organization or if you know the name of the manager, make sure you mention that, and
Mm.
try to write a little bit about yourself, and why do you think you are a good fit for that position.
Can you explain a little more about that? Because I find that sometimes, when somebody says, "Oh, what do you like? Tell me about yourself," it's like, uh. So,
Mhm.
like, what are you looking for when you say somebody to talk about themselves in their resume? Like, how far do they go? What
Mhm.
exactly are you looking for?
So not a lot of information. Like, suppose if you just graduated and you were working as a PSW previously, just mention that, and then always read the job description first,
Mm,
because if you read the job description, whatever they're asking for, just try to write your skills related to that particular description.
right.
The main problem is the candidates are using the same resume everywhere.
Hmm.
You're applying for the 50 jobs with the same resume. That is not helpful.
Right.
What do you think?
Yeah.
Why that is, Patsy?
It doesn't stand out,
Yeah,
right? Like it's just very like blanket statement.
yeah,
Yeah, I can work.
that's right.
Like there's nothing grabbing, and it shows like you don't have any initiative or you don't actually even care for the job. It's
That's
just
right.
like, if you want to hire me,
Yep.
you know.
Yeah, make sure you add the cover letter, because as Patsy mentioned about the initiatives, if you have the cover letter mentioning the organization name, or if you know the manager's name, and write a little bit about yourself. If I have that, then I see that you put some initiatives. You put some initiatives,
Mm,
reading about the organization, or making a cover letter explaining how you think that you are a good fit for this position.
right,
Yeah.
right. No, that's a
So I
good
think
point.
that is something that I'll highly recommend everybody.
So a lot of times I find that, especially even myself, like as a new grad
Mhm.
or a new nurse, we want to go into the hospital, and
there's not enough jobs for us in the hospital. So what are some other places that we can apply? Because I know sometimes the idea is you want to go to the hospital, keep up with your skills and things like that, but what are some other great areas that we can apply for as nurses as well?
Yeah, that is a really good question, Patsy. That's what I was thinking when I was a new nurse. But I started my journey from long-term care home. I am currently working in a long-term care home as assistant DOC, and that's where I hire nurses, part of my job. And I also work in the hospital on a surgical unit. But I started my career from long-term care home. So make sure you apply retirement homes, long-term care homes. If you're not hearing back from the hospital, that is a good place to start.
Absolutely.
Right? And then the other thing that I noticed that a lot of people don't know, especially on my channel, I get a lot of comments, they don't know how to apply for the hospital jobs. Most of the hospitals have a career pages online, their website. Go there and apply there, and it will give you the opportunity to upload your documents, and then that's where you apply for the hospital jobs, career pages online.
So I noticed that a lot of times they'll ask for maybe like different certificates and things like that. What kind of certifications are they looking for?
So for nursing, first of all, the CPR, or the basic life support certificate, especially as nurses, for us too, like it is our responsibility to make sure CPR certification is all up to date.
Right.
So make sure you have that, or your N95 mask fit testing. So suppose if I have two candidates, one with all these documents ready, one who's going to prepare for these documents, who do you think I'm going to hire?
Obviously, the person who's prepared.
Yes. So make sure you have these documents, like, as I mentioned, N95 mask for testing, your CPR all up to date, your police clearance or TB testing, because these are the required documents. Doesn't matter which setting you apply for healthcare, you have to have these documents.
That's true.
So if you have all these ready, that's going to be good for you. And also, if you want some kind of extra certification, you're looking to work in long-term care, get your GPA or PCES training, right? Or get a wound care certification or IPAC certification. It's always good idea to have that, even though it's not only for the new grad nurses, for anybody.
I think it really kind of gives you an edge over another candidate. Why I say that is because if I have somebody who is coming to me and already has different certifications, and I have somebody who has none or maybe just one, this person shows me that they're willing to learn.
That's right.
This person shows me that they're prepared. So that's somebody that I want on my team, somebody that already has some knowledge but also is taking that initiative to do things. Right. So I think that gives somebody a really good edge.
And it's like ongoing learning for nursing.
All the time.
It's changing every day. So while you're working, you'll learn, but make sure you keep yourself up to date.
Yeah, for sure.
Yeah. The other thing I will highly recommend everybody, make sure you read the job description. Make sure you go on the website, read about the organization, what kind of services they provide to the patients. If you're looking in the hospital, look for that particular unit, what kind of patients are there. It's going to be helpful for you for the interview as well. You'll feel more confident if you know this.
Right. That's a very good point. You know what, actually, that's another video that we're going to do that I want you guys to check out is the interview process, some tips and things like that you guys can have and that will support you for the interview process.
For sure. And one thing I want to share my experience from last year as a manager. I had a resume, and then there was a follow-up email from that candidate. I highly recommend you doing that as well. That person wrote a very professional email following up on the resume, and then I got back to that person because at that time I didn't have any more positions available. It was for a PSW job, and that person again sent me another email thanking me for getting back to them, and very professionally written email. And I saved that email, and 6 months later, when I had the positions available, I contacted that person. So so something like that, make sure you follow up. And every time you apply, and I know I hear from a lot of candidates, like they applied for 50 to 100 jobs, but nobody's getting back to them. The question from me is, are you keeping track how many applications you submitted and where?
Right.
If you're not keeping track, it's not going to be helpful.
Yeah, for sure.
You need to keep track when you applied. 3 or 4 weeks after, if you're writing a follow-up email, is the position still available? So these are the initiatives you need to take. It's not just open Indeed and submit and that's it.
Right.
So you need to make sure you take extra initiatives and have all those documents ready.
Yes.
Especially when you are, as Patsy mentioned, we will be making another video for the interview, but recent experience for me, Patsy, for the PSW positions, I had candidates showing up with no documents at all in their hands, like no file, no
Yeah.
pen.
I'll email you. Oh, I need what again?
Yeah.
Okay, yeah. What's your email? Okay, I'll send it to you.
Yeah, that is not a good impression for
At
sure.
all. At all.
Like when I used to go for the job interviews, I had my file with the original documents
Yes.
and a photocopy.
Multiple copies.
And I understand, it's everything is online now, but it shows the initiatives when you are
100%.
giving all your copies and presenting that to the manager. It's impressive.
It shows you want the job.
Yeah, that's right.
Baseline. Yeah.
So make sure you do that. But firstly, start with your resume. Don't use the same resume everywhere. Look at the job description. If you have those skills, update your resume accordingly.
Right.
If you are using the same resume everywhere, it is not going to be helpful for sure.
That's true. That's true. Well, thank you for your tips.
I think I have more, but because I worked this morning, me and Patsy both, we barely have time to make the video, but so I'm a little bit tired. But if I have more tips, we can always make another video and share.
Absolutely.
If you have any questions, please comment so that we can get back to you.
Absolutely. Thanks for listening, guys. We'll see you.
Okay, bye-bye.
Bye.